Welcome to EMS training. My name is Sam Scheller, and today we're talking about the Southern Nevada Health District's Trauma Field Triage Criteria Protocol. The Trauma Triage Field Criteria Protocol, or TFTC for short, breaks patients into one of four categories. The first category looks at the patient's vital signs and level of consciousness. The second category looks at the anatomy of injury. The third category looks at mechanism of injury or evidence of high energy impact. And the last category looks at special patients. And patients are to be transported to an appropriate trauma center based on these categories. A Step 1 trauma looks at the patient's vital signs and level of consciousness. A patient meets Step 1 criteria if they have a GCS of less than 13, they have a systolic blood pressure of less than 90 millimeters of mercury, or have inefficient respiratory drive. In the adult or pediatric patient, that would be a respiratory rate of less than 10 or greater than 29 breaths per minute. And in the infant patient, that is a respiratory rate of less than 20. In addition, if the patient needs any kind of ventilatory support, they immediately step to a Step 1 trauma. Adult patients who meet Step 1 criteria are to be transported to a Level 1 or a Level 2 trauma center. Pediatric patients who meet Step 1 criteria must be transported to a pediatric center for the treatment of trauma. A Step 2 trauma assesses the patient's injury. A patient meets Step 2 criteria if they have a penetrating injury to the head, neck, torso, or extremities proximal to the elbow or knee, have chest wall instability or deformity like a flailed chest, they have 2 or more proximal long bone fractures, they have a crushed, degloved, mangled, or pulseless extremity, they have amputation proximal to the wrist or ankle, they have a pelvic fracture, they have an open or depressed skull fracture, or there's paralysis. Adult patients who meet the Step 2 criteria shall be transported to a Level 1 or a Level 2 trauma center. Pediatric patients who meet the Step 2 criteria shall be transported to a pediatric center for the treatment of trauma. A Step 3 trauma looks at the mechanism of injury or evidence of high energy impact, including falls, auto collisions, motorcycle crashes, or auto versus pedestrian crashes. Falls would include a fall greater than 20 feet for the adult patient, or for a pediatric patient, this would be a fall greater than 10 feet or 2 times the patient's height. A high-risk auto crash would include a motor vehicle traveling at least 40 miles an hour immediately before the collision, intrusion of the vehicle, including the roof of greater than 12 inches on the occupant site or 18 inches anywhere on the vehicle, ejection, partial or complete from an automobile, a motor vehicle that rolled over with an unrestrained occupant, motorcycle crashes greater than 20 miles an hour, and lastly, an auto versus pedestrian or bicyclist that is thrown, run over, or hit with significant impact. Significant impact is more than 20 miles an hour. If a patient meets Step 3 of the Trauma Field Triage Criteria Protocol, then they are to be transported to a Level 1, 2, or 3 trauma center in accordance with the catchment areas discussed later on. If the patient is injured more than a 50-mile radius from a trauma center, then the transporting ambulance crew shall consider transporting to the nearest receiving facility. A Step 4 trauma occurs when a patient does not meet the criteria mentioned previously, but has some underlying risk factors that would predispose the patient to long-term injury from a traumatic event. For example, in older patients, the risk of death and injury increases after the age of 55. After the age of 65, a systolic blood pressure less than 110 millimeters of mercury could represent shock, and low-impact mechanisms, i.e. ground-level falls, might result in severe injury. Children should be triaged preferentially to a trauma center. Those patients taking anticoagulants or have bleeding disorders can be at high risk for deterioration, especially for those with head injuries. And burns also play a factor into Step 4 trauma. If the patient is burned and does not have other trauma mechanisms, then the patient should be transported in accordance with the burns protocol. If the patient has trauma mechanism, then the patient shall be transported in accordance with the catchment layers described a little bit later. It is important to note that if the burn patient falls within the catchment area of St. Rose Sienna, then the patient is to be transported to Sunrise Hospital. And if the burn patient falls within Michael Callahan's catchment area, the patient is to be transported to UMC Hospital. In addition, pregnant patients over 20 weeks or patients that the provider feels should be taken to a trauma center are Step 4 trauma patients. If the patient meets Step 4 of the TFTC, they are to be transported to a Level 1, 2, or 3 trauma center in accordance with the catchment areas described later on. If the patient is injured more than a 50-mile radius from a trauma center, then the transporting ambulance crew shall consider transporting to the nearest receiving facility. The Southern Nevada Health District allows its EMS providers to transport to one of 4 trauma centers depending on the patient's condition and cause of injury. These trauma centers include St. Rose Sienna, Michael Callahan Military Medical Center, Sunrise Hospital, and University Medical Center. St. Rose Sienna is a Level 3 trauma center. It can accept patients that meet the Step 3 or Step 4 criteria and can accept pediatric patients that meet Step 4 criteria. The catchment area includes anywhere within the city of Henderson or the unincorporated area of Clark County that includes Interstate 15 to the west, Sunset Road to the north, and the county line to the east. If the patient falls within this catchment area, then the patient shall be transported to St. Rose Sienna, and medical direction for the treatment of the patient must originate at that trauma center. Michael Callahan Military Medical Center is a Level 3 trauma center. It can accept adult patients that meet the Step 3 or 4 criteria and can accept pediatric patients that meet Step 4 criteria. The catchment area includes Pecos to the west, Interstate 15 to the west and northwest, and Lake Mead Boulevard to the south. If the patient falls within this catchment area, then the patient shall be transported to Michael Callahan Medical Military Center, and the medical directions for the treatment of the patient must originate at that trauma center. Sunrise Hospital is a Level 2 trauma center. As a Level 2 trauma center, it can accept all adult patients and Step 3 or Step 4 pediatric patients. The catchment area includes Paradise Road to the west, Sahara Avenue to the north, Sunset Road to the south, and the county line to the east. In addition, if the adult trauma patient meets Step 1 or Step 2 of the trauma triage field criteria, and the incident occurred within the St. Rose Sienna catchment area, City of Henderson, or the geographical area bordered by Paradise Road to the west, continuing where it becomes Maryland Parkway, Sunset Road to the north, and the county line to the east, then the patient is to be transported to Sunrise Hospital. University Medical Center is an adult Level 1 trauma center and a pediatric Level 2 trauma center. Any call that occurs within any other area of Clark County shall be transported to University Medical Center, and the medical directions for the treatment of the patient must originate at that trauma center. UMC will also receive all pediatric Step 1 and Step 2 trauma calls. In addition, adult trauma calls that meet Step 1 and Step 2 and occur within Paradise Road to the east, Sunset Road to the north, Interstate 15 to the west, and the county line to the south shall be transported to UMC Hospital. Further, if the patient has to be flown by air ambulance to a trauma center, they shall be transported to UMC Hospital regardless of the location of incident. There are 2 exceptions to note when applying the trauma field triage criteria protocol. The first, nothing contained within these guidelines precludes transport to any trauma facility if, in the provider's judgment, time to transport to the designated center would be unduly prolonged due to traffic and/or weather conditions and might jeopardize the patient's condition. And second, nothing contained within these guidelines precludes transport to the closest facility if, in the provider's judgment, an inability to adequately ventilate the patient might result in increased patient mortality. This brings us to the end of the training for the Southern Nevada Health District's Trauma Field Triage Criteria Protocol. To recap our discussion, patients involved in a traumatic situation are going to be classified as a Step 1 through 4. A Step 1 trauma assesses the patient's vital signs and mental status. A Step 2 trauma assesses the patient's anatomy of injury. A Step 3 trauma assesses the mechanism of injury or assesses for evidence of high energy impact. And lastly, a Step 4 trauma involves special populations, including the elderly, the very young, those taking anticoagulants or those with bleeding disorders, burns, pregnant patients greater than 20 weeks, or patients who should be transported to a trauma center based on the provider's judgment. And lastly, there are 4 trauma centers that a patient can be transported to. UMC Hospital, which is a level 1 trauma center, Sunrise Hospital, which is a level 2 trauma center, St. Rose Sienna, which is a level 3 trauma center, and lastly, the newest hospital to receive its trauma center accreditation is Michael Callahan Military Medical Center, which is a level 3 trauma center. Thank you for watching this video, and don't forget to smash that subscribe button for more EMS related content.